Hi everyone, Mike Leone here at Choice Restorative Medicine. I just want to tell you a little bit about knee pain, some misconceptions about knee pain, both in how your knees hurt in the first place and how they're being treated and how we here do something differently to make them get better, okay? So I've entitled this here, Why Did My Knees Hurt? Okay, so first of all, what causes knee pain isn't necessarily an injury, although it can be. Things like lack of exercise, obesity, problems in other joints in your body can lead to muscle imbalances in your body that put undue stress on the knees. So, firstly, you get your kneecap shifting over, or most often it's something called patellofemoral pain syndrome and dysfunction. This leads to your kneecap grinding on the wrong part of your knee, which causes osteoarthritis underneath your knee. And then after that, you get ligament laxity, which are the tissues that hold your knee together. And now all of a sudden, your knee's loose, which some of you may be experiencing. And that leads to arthritis. As we know, arthritis leads to getting a knee replacement eventually. Okay? So this is what we think of usually, right? We think about the arthritis, we think about the knee replacement, we might think about the fact that we don't exercise and have obesity, but we tend not to think about this progression of things that leads to this ends. We can do things to treat everything along the way to stop you from getting to this end, okay? So how can we fix it? Things like weight loss and exercise and physical therapy are still crucial. However, chiropractic can put other joints back in place so that you're in balance and you're not putting undue stress on your knees. And then something called biocellular medicine, which is like a new way to approach treating osteoarthritis and other problems in your musculoskeletal system. Okay, so what is it? It's been around for the last few decades. They've been using it in sports. You might have heard about it for that reason. The products that we use here and are used in most other places are stem cell containing products like umbilical cord blood, amniotic allograft, and platelet-rich plasma. Okay, so here's our diagram from before. Here's how we're going to use our approach to fix it. First of all, we're not just going to put the medicine right in the joint. So your amniotic allograft, umbilical cord blood, stem cell tissue, and PRP are not going to just go in your knee joint here. They're going to go in the tissue surrounding your kneecap to help straighten it out, underneath your kneecap to help the arthritis, into the ligaments to try and tighten them back up, and then also into the kneecap, of course, to help resolve the arthritis. So we're doing all of these things. And then of course, we're going to be always encouraging exercise and weight loss if that needs to happen. These are the things that are going to stop your progression to the severe osteoarthritis and getting the knee replacement. And then of course chiropractic, like I mentioned earlier. So how is this different, just to demonstrate with our diagram, than what you would do typically maybe with an orthopedic doctor? Well, first, he'd give you a cortisone shot in the knee, right? Tell you to go to physical therapy, tell you to lose weight if that needs to happen. Then eventually, he's just gonna do the knee replacement, okay? Orthopedic surgeons are not trained to look at these issues here. Not so much that they don't understand them, as that they just don't have a tool in their toolbox. We do, and we want to help you by using those.